This is Richard Wolff from Democracy at Work, responding to another Ask Prof. Wolff question from our Patreon community. And this question comes from Nicole Armand. She asks me to comment on some of the work of Catherine Austin Fitts, a leader in the movement to question and challenge recommendations for treating COVID with various vaccines and so forth, locking down around the pandemic, work she has done with Robert F. Kennedy in those areas about vaccination. She was also a worker and member of the cabinet, or an assistant secretary, under the George Bush regime in Washington back at the end of the 20th century. I'm not familiar in detail with her particular work, but I wanted to answer because there's an important issue here. One of the many negative consequences of allowing your health system to be owned and operated overwhelmingly by profit-driven capitalist enterprises is that people have very legitimate reasons to be suspicious, to be skeptical, and to wonder about the motivations and the safety of using medications, following specific treatments, and so on. One of the reasons a public health system ought to be run and operated by a combination of medical and scientific leadership that is accountable to people, the mass of people with their questions about diseases, medications, treatments, etc., is that it at least means not that everything will be perfect, but that you will not have intruding into those difficult discussions among the medical experts, the scientists, and the general concerned public. You won't have intruding in it people who have a completely different and basically unrelated motivation, namely to make money. Drug companies, medical device companies, medical insurance companies, and a great many hospitals and medical practices are driven by people whose bottom line, they will tell you, are profits. They in it to make money, and that's how the capitalist system works. They learned that, they follow that, they seek to do that, and in this system, that is permitted not only in terms of making your shoes, or making your toaster, or making the shirt you wear, it's also allowed to shape the medical information you get, the insurance coverage you get, the medications you put into your body, etc. And so people are rightly wondering, is the advice I'm getting the best that can be done by doctors and nurses and scientists and a concerned public that has legitimate questions based on its own observations and experiences? Or are those things maybe swamped by the power of huge corporations to shape these conversations the way they want, to flood the airwaves with advertisements for this or that medication, for this or that treatment, and so on? You all understand what I'm saying. I am not a competent judge of the very conflicting information that is coming from the government, that is coming from the scientific community, from the medical community, from the general public, and also from profit-driven corporations. I think we would all be much better off if that last one were removed from the equation, when we did not have to worry that the information we were receiving had the ulterior motive of profit-making. Medical care is too important to be left to capitalism. It's what we have learned by this COVID pandemic, really, haven't we? Private companies did not produce and store the tests, the ventilators, the masks that should have been and could have been ready to deal with this issue. They didn't because it wasn't profitable. It was too risky. Well, public health shouldn't be left to the whims of a profit-driven enterprise. That was a big mistake. Most other countries in the world do not allow the extent of private profit-making to shape medical practice the way they do in this country. Not even in the United Kingdom, which in other ways is quite similar. So for me, the lesson of the work of Kennedy and Fitz and others is not about the specifics of the arguments they make, but it's about allowing profit-making enterprise to be nosing around using massive resources to shape a conversation that they have a vested interest in turning in one particular way. That's not what our health should be held hostage to. This is Richard Wolff for Democracy at Work, thanking our Patreon community.